Hello, my dear friends. I am myself Dr. Rajesh Gubba, and I welcome you all to the today's daily dose. And I am also the mentor for teaching general medicine in subjects like AIMS, PGI, JIPMER, and as well as NEET PG. So, as the part of today's daily dose, the clinical question is: I have a 52-year-old woman, and she has been treated for several days with amlodipine and lisinopril for what she has been presumed to be primary hypertension. So basically, she is having primary hypertension, and for which she is on calcium channel blocker and ACE inhibitor. And she is seen by her general practitioner having complaint of persisting left loin pain. So this is a very important history in this patient. And the blood pressure of the individual is 150 by 95 millimeters of mercury, and she is also having tenderness in the left loin, and both the kidneys appear to be enlarged on palpation. And on urine dipstick testing, there is microscopic hematuria which is being present. So this is also another important finding. So which of the following is most likely to be the investigation at this point? Urinary tract ultrasound, CT scan, abdominal and pelvic CT scan, microscopy of the urine, renal biopsy, and intravenous urogram. Now, the clinical points here is that the individual is having persistent left loin pain, and as well as on palpation, both the kidneys are palpable or enlarged. So, you have to think of what is the underlying clinical scenario causing this condition. Left loin pain, and as well as both the kidneys are being enlarged. So very important differential diagnosis what has to come to your mind is your polycystic kidney disease, right? And that to 52-year-old women. So adult polycystic kidney disease, what has to come to your mind? Now, whenever there is a polycystic kidney disease, what would be the most appropriate investigation? The most appropriate investigation in her would be the ultrasound, right? That is urinary tract ultrasound. Urinary tract ultrasound means it includes your kidneys, the ureters, the bladder. So these are all the things which are included in your urinary tract ultrasound. So for the diagnosis of your polycystic kidney disease, the appropriate method of investigation is the urinary tract ultrasound. But the point is that even if you do CT scan also, you will get the diagnosis of your polycystic kidney disease. But if you take the CT scan, it is very expensive, and as well as it may be requiring the contrast also. So there is chances of the contrast induced nephropathy. So it is very expensive. So that is the reason why when we are getting a proper diagnosis with the ultrasound, then what is the purpose of requirement of a CT scan except for a high resolution what we will be getting in the image? So the most appropriate investigation at this point is urinary tract ultrasound. And microscopy of urine, you take the third option. Already, like microscopic, the urine dipstick testing, it is showing microscopic hematuria. And what is the additional information you will get in patients with polycystic kidney disease in microscopy of the urine? Except for the presence of the RBC on urine examination, you will not get any other further information. Renal biopsy is not indicated in patients with the polycystic kidney disease, and intravenous urogram is also not useful in this particular patients with the adult polycystic kidney disease. See, actually this is a very easy question, but the only thing is you should come to a conclusion of the diagnosis of polycystic kidney disease based on the clinical examination and as well as the clinical history. So the clinical history is left loin pain, both the kidneys are enlarged on palpation, and urine microscopic examination showing hematuria. These findings, and the other important finding is the presence of hypertension. Hypertension is a very important feature in patients with the polycystic kidney disease. So with these particular points which is given in your history, you should come to a conclusion of the polycystic kidney disease. Then the answer becomes very easy for you. But even if you take the standard textbook says the investigation of choice is the CT scan. But in this particular scenario, see, except for the more diagnostic information, without yielding more diagnostic information in this case, then high quality ultrasound, the CT scan will not be of very much use. Why? Because it is more expensive, and as well as the individual is also being exposed to the radiation. So that is the reason why CT scan is not being preferred in this particular clinical scenario. And another important thing, like what we can make out in the ultrasound is that, so before that let me tell you about the polycystic kidney disease. Polycystic kidney disease is mainly because of the gene mutation. And what type of inheritance is this? This is autosomal dominant type of inheritance. Adult polycystic kidney disease, autosomal dominant type of inheritance. Whereas you take the polycystic kidney disease in case of children. In case of children, it is autosomal recessive polycystic kidney disease. So this is a very important difference that you should know. And this polycystic kidney disease is mainly because of the gene mutations. And what are these gene mutations? PKD1 and as well as PKD2. And these genes, they encode for a protein called polycystin 1 and as well as polycystin 2. And the other important multiple choice question that they will ask you is about the chromosomal number on which these particular genes are present. So if you take this PKD1, it is present on the chromosome 16. And if you take this PKD2, it is located on the chromosome 4. So these two are the very important points that you need to remember related to the chromosomal number. PKD1 located on chromosome 16, PKD2 present on the chromosome 4. So, and other important thing like what you get in the ultrasound is that, remember, the diagnosis of your polycystic kidney disease depends upon the number of cysts like what you get on the ultrasound, and that too according to the age group. Like for example, you see, if the age of the individual is in between 15 and 29 years, how many cysts has to be present on the ultrasound? Minimum, there should be presence of 2 renal cysts. And this particular 2 renal cysts, either they are unilateral or bilateral. So that will give you a conclusion that the individual is suffering with the polycystic kidney disease. If again only 1 renal cyst is there, we cannot tell that the patient might be suffering with the polycystic kidney disease. So that is when the age group is in between 15 and 29 years. Whereas if you take the age group in between 30 and 59 years, so how many cysts should be there? Remember, the presence of at least 2 cysts in each kidney. Like for example, if you take the age group between 15 and 29 years, the 2 cysts, it should be either unilateral or bilateral. But if the age group is in between 30 and 59, the 2 cysts should be present in both the kidneys. That is the important difference between 30 and 59 years and 15 and 29 years. Next, if you take the age group around 60 years, how many cysts should be there within each kidney for diagnosing polycystic kidney diseases? At least 4 cysts should be there in each kidney for the diagnosis of the polycystic kidney disease. So this particular question is completely related to the discussion on the polycystic kidney disease. So the very important clinical point is the loin pain, palpable kidneys, microscopic hematuria on urine dipstick. So these are the points in favor of your polycystic kidney disease, and the appropriate investigation is renal ultrasound. So thank you very much. I hope you might have liked this particular short video on the polycystic kidney disease. So please follow us for the daily updates in the daily dose. Thank you very much.